Every year, hundreds of thousands of older adults land in the emergency room with sudden kidney injury, and for a striking number of them, the cause wasn't a disease at all. It was something sitting in their medicine cabinet, taken exactly as directed, for something as ordinary as a headache or a sore back. Your kidneys filter roughly 50 gallons of blood every single day, and after 65, that filtering system is naturally running with less reserve than it used to, which means it takes less to tip it over than most people realize. I'm not here to sell you fear. I'm here to explain the why behind your body, not just hand you a list and walk away. Today, I'm walking you through 8 common pills, several of them sitting in most households right now, that carry a real, documented kidney risk after 65, what each one actually does inside your kidneys, and the specific doctor-worthy warning sign for each one. Stay with me to number 1. It's the single most common one on this list, something tens of millions of people reach for without a second thought. And when it's combined with 2 other very ordinary medications, doctors have a name for it: the triple whammy. I'll explain exactly what that means and how to know if it applies to you. Before we start, tell me your age and where you're watching from. I read these, and they shape what I cover next. A quick note first. This channel is for general education, not medical advice, and I'm not your doctor. Nothing here is a diagnosis or a prescription. Always talk with your own doctor or pharmacist before changing anything about your medication, diet, or treatment. Here's what almost no one explains in a 15-minute visit. Your kidneys aren't one simple filter, like a coffee filter catching grounds. They're more like a delicate river delivery system, a constant flow of blood moving through millions of tiny filtering units, each one depending on steady pressure and steady blood flow to work correctly. Most of the medications on this list hurt your kidneys through one of 3 doors. Some of them narrow the delivery pipes going into the filter, starving it of blood flow. Some of them directly irritate or inflame the filtering tissue itself, the way a splinter irritates skin. And some of them simply ask more of the filter than it has the reserve to handle, especially when you're dehydrated, sick, or already losing fluid. Once you know which door a medication uses, the warning sign for it makes complete sense. Name plus frame. We're starting here because it's the one people least expect. Natural doesn't mean kidney safe. Mechanism. Some herbal weight loss and traditional remedy products, particularly certain imported or unregulated ones, have been found contaminated with a plant compound that is directly, severely toxic to kidney tissue. It damages the filtering units in a way that can be irreversible. Analogy: think of it like drinking water you assume is filtered from a source no one has actually tested. Evidence drop. Documented cases of this kind of herbal-associated kidney failure go back decades and are well established in nephrology literature, which is why supplement contamination remains a recognized, if uncommon, cause of kidney injury. Prescription. If you take an herbal or detox supplement, especially one bought online or from an unregulated source, bring the bottle to your doctor or pharmacist and ask them to check it. Don't assume natural means tested. Bridge. That's the rare, hidden one. The next one is sitting in almost every medicine cabinet in America. Name plus frame. Number 7 surprises people every time, taking too much of a good thing in supplement form. Mechanism. When vitamin C is taken in very large doses well beyond what a multivitamin or your diet provides, your body breaks down the excess into a compound called oxalate, which your kidneys have to excrete. In some people, especially those with any existing kidney reserve issues, that oxalate can crystallize inside the kidney. Analogy. Picture sugar dissolving easily in a small glass of water, but crystallizing out the moment you try to dissolve too much in too little liquid. Your kidneys are that glass. Evidence drop. This is a recognized described phenomenon in kidney literature associated specifically with high-dose vitamin C supplementation, not with eating oranges. Prescription. A standard multivitamin dose of vitamin C is not the concern here. It's the habit of taking large, standalone megadoses for immunity. If that's you, mention it to your doctor, particularly if you've ever had a kidney stone. Bridge. Next is something almost everyone takes before a routine medical procedure, and almost no one is warned about. Name plus frame. If you've ever prepared for a colonoscopy with an over-the-counter phosphate-based prep, this one applies to you directly. Mechanism. These preps work by pulling a large volume of fluid into the bowel very quickly. In the process, they can flood the bloodstream with phosphate, and in someone whose kidneys already have reduced reserve, that phosphate can deposit directly into kidney tissue, a distinct documented condition. Analogy: it's like flushing a system so aggressively that some of what you're flushing gets left behind and clogs the works. Evidence drop. This risk was significant enough that health regulators added a formal safety warning specifically about kidney injury to these products, and many prescribers now favor alternative PrEP formulas for older adults as a result. Prescription. Before any bowel prep procedure, tell your doctor your age and any kidney history, and ask specifically whether a phosphate-based PrEP is the right choice for you or whether an alternative makes more sense. Bridge. The next one hides in a category most people trust completely: antibiotics. Name plus frame. Not all antibiotics carry this risk, but one well-known family does, and it's frequently prescribed for urinary infections in exactly this age group. Mechanism. Fluoroquinolone antibiotics, the ones with names ending in floxacin, can, in some people, directly inflame the delicate filtering tissue of the kidney, a reaction called acute interstitial nephritis, or in rare cases contribute to crystal formation in the urine. Analogy. Think of it as the antibiotic occasionally irritating the very filter it's passing through on its way out of your body. Evidence drop. This risk is well enough established that regulatory agencies have issued specific safety communications about this drug class and kidney and other risks in recent years, particularly for older adults. Prescription. If you're prescribed one of these antibiotics, ask if there's an equally effective alternative, especially if you have any kidney history and if you notice decreased urination, blood in your urine, or new swelling while taking it. Call your doctor promptly. Don't wait for the course to finish. Bridge. Next is a medication you may already be taking for the exact same reason we talked about last video, but it becomes dangerous under one very specific condition. Name plus frame. We covered hydrochlorothiazide's electrolyte risk in an earlier video. Here's its kidney-specific danger, and it applies to most water pills. Mechanism. Diuretics work by telling your kidneys to release more fluid. That's the whole job. But if you become sick, a stomach bug, a fever, reduced eating or drinking, and keep taking a full-strength diuretic on top of fluid you're already losing, your kidneys can be asked to filter with too little fluid volume moving through them at all. Analogy. It's like continuing to drain a pool that's already losing water through a separate leak. Eventually, there's not enough left to circulate properly. Evidence drop. This sick day vulnerability is well recognized enough that many prescribers now give patients specific instructions to temporarily pause certain medications, including diuretics, during acute illness with vomiting, diarrhea, or reduced fluid intake, sometimes called sick day rules. Prescription. Ask your doctor or pharmacist in advance whether you should be given sick day instructions for your specific diuretic. Having that plan before you're sick is far safer than guessing in the moment. Bridge. Now we're into the top 3, starting with a medication class taken by an enormous share of adults over 60, often for years, often without anyone rechecking whether it's still needed. Name plus frame. This is a different concern from the memory-related claims you may have heard about this drug class. This one is about the kidneys specifically, and the evidence here is more consistent. Mechanism. In some long-term users, PPIs can trigger the same kind of kidney inflammation we mentioned with antibiotics, acute interstitial nephritis, which, if it isn't caught, can, in some cases, progress toward more lasting kidney decline. Analogy. Think of low-grade inflammation as a slow leak in the filter's seal, not dramatic on any single day, but adding up over months if no one's checking. Evidence drop. Multiple large observational studies have found an association between long-term PPI use and higher rates of kidney injury and chronic kidney disease. Strong enough that major gastroenterology guidelines now recommend using the lowest effective dose for the shortest necessary time and periodically reassessing whether ongoing use is still needed. Prescription. If you've been on a PPI for heartburn for more than a few months, that's worth a specific conversation, not to alarm you, but because many people can step down to a lower dose, an as-needed schedule, or a different type of medication entirely once your doctor reassesses. Bridge. Now, the second most important item on this list, a medication that protects your kidneys in normal circumstances but becomes a liability under one specific condition. Name plus frame. If that phrase sounds familiar, it should. We covered lisinopril and losartan's other side effects last video. Here's their kidney-specific vulnerability. Mechanism. These medications work in part by relaxing the tiny blood vessel exiting each filtering unit in your kidney, which normally reduces internal pressure and protects the kidney over time. But that same mechanism depends on adequate blood flow coming in. If you're dehydrated from illness, from heat, from not drinking enough, that same protective relaxation can drop filtration too low. Analogy. It's a pressure release valve that's a genuine asset when the system has enough flow, and a genuine liability when the system doesn't. Evidence drop. This is precisely why sick day rules, the same concept from diuretics, commonly include temporarily pausing ACE inhibitors and ARBs during a stomach illness or significant dehydration under medical guidance. Prescription. Ask your doctor whether you should have a sick day plan for this medication too, and make sure you're drinking adequately, especially in hot weather or during any stomach illness. Bridge. And now, the one I asked you to stay for the most commonly used medication on this entire list, and the one behind a phrase every kidney doctor knows by heart. Name plus frame. This is the biggest one, because it's the most common over-the-counter pain reliever in the country. Taken casually, often without anyone thinking of it as a medication at all. Mechanism. Your kidneys rely on a certain internal signal to keep the blood vessels feeding the filtering units open and relaxed, especially when your body is under any stress. NSAIDs, ibuprofen, naproxen, and their relatives block the production of that exact signal. In someone with normal reserve who takes an occasional dose, that's usually not a problem. But in an older adult, especially one who is also dehydrated, or also on a diuretic, or also on an ACE inhibitor or ARB, the incoming blood flow to the kidney can drop sharply. Analogy. If ACE inhibitors and ARBs are a pressure release valve, NSAIDs are the pipe supplying water to the whole system, and squeezing that pipe while the release valve is also open is where real trouble starts. Evidence drop. Nephrologists have a specific name for the combination of an NSAID plus a diuretic plus an ACE inhibitor or ARB taken together. The triple whammy. It's a well-documented combination linked to a meaningfully higher risk of acute kidney injury, and it's exactly why pharmacists are trained to flag it. Prescription. If you take a blood pressure medication and a water pill, treat over-the-counter ibuprofen or naproxen as something to check with your pharmacist first, not something to grab automatically. Acetaminophen is often a kidney-safer option for pain, though it comes with its own considerations your doctor can walk you through. Bridge. Every item on this list shares one thread, and it's worth naming plainly before we close. Consider a woman in her late 70s, call her Margaret, managing her blood pressure well on a diuretic and an AC inhibitor for years, feeling completely fine. Then a bad summer cold left her barely drinking fluids for 2 days, and instead of resting it out, she reached for ibuprofen for the body aches, the same bottle she'd used her whole life. 3 medications, all individually reasonable, all working against her kidneys at exactly the same moment. By the time she felt truly unwell, her kidney function had dropped sharply enough to need a hospital visit. It resolved with fluids and monitoring, but it never needed to happen, and once she understood the why, she never repeated it. Here's why every one of these matters together, not just separately. Your kidneys after 65 are running with less reserve, which means combinations matter as much as individual medications do. None of these 8 are reasons to panic, and none of them mean you should stop anything on your own. Remember, stopping a blood pressure medication or diuretic abruptly carries its own real risk. What they mean is that a slightly more specific conversation with your doctor or pharmacist is worth having. Tonight's simple plan: pull out everything you currently take prescription, over-the-counter, and supplements, and bring the actual bottles, not just a list from memory, to your next appointment or pharmacy visit. Ask specifically, is anything here a concern for my kidneys, especially in combination? That one question and that one conversation is how most of these risks get caught before they ever become a real problem. If this helped you look at your own medicine cabinet a little differently, Type the number 1 inch the comments for the triple whammy, the one worth remembering most. And tell me which of these 8 is currently in your cabinet. Your answer might be exactly what helps someone else reading these comments catch it early too. There's a related warning sign we haven't covered yet, the specific changes in your urine that can be your kidney's earliest way of asking for help, often months before a blood test would catch it. That's the video I want you to watch next.